Mr. Lewison.
Teresa.
Mr. Speaker, in assessing the need for a medical certificate and its duration, both medical conditions and the non-medical circumstances need to be considered. These include the type and severity of the medical condition or injury, time needed for the treatment, rehabilitation and recovery, and work requirements and workplace conditions. The circumstances vary widely among different persons, making it very difficult to come up with prescriptive guidelines. The attending doctor should use his or her professional judgment, and when in doubt, consult fellow peers on what is needed to help the patient recover from a medical condition or injury. To guide this, the SMC revised the ethical code which came into effect in 2017. This provides broad guidelines that medical certificates must be issued to patients on proper medical grounds arrived at through good clinical assessment, and doctors must not take into consideration extraneous factors such as who pays for the consultation, what benefits the patients may receive, or what employers' preferences may be. Also, when certifying that patients are fit to return to work, but with limitations on the level of activity at work, doctor must first ensure that the patient's work conditions allow this, and to the best of their ability, ensure that appropriate light duties are in fact available to the patients at their place of work. MOH will study if it is necessary to formulate specific guidance in particular settings and seek inputs from the professional bodies.
Mr. Lewison.
Thank SMS for the reply. I just want to check the last part. You said that MOH is going to study this issue. Is it going to conduct a review on whether we can set up more specific guidelines rather than the broad guidelines we have in our code now? And the second, I think, I'm asking in relation to the recent case where the doctor issued the 2 days of light duty for the worker that had a broken collarbone. So how does MOH ensure that the appropriate number of medical leave or light duties is issued after surgery or after a work-related accident?
Mr. Speaker, as alluded in my reply, I think there are already existing broad guidelines issued by SMC in their ethical codes, which gives some guidance to doctors what they need to do. With regards to whether we will come up with any specific guidance, this is an area where we will actually consult the professional bodies to study whether it is feasible or practical to even do so. But if the professional bodies do think that there may be scope to provide some form of guidance for certain types of injury, then we may go ahead with that. But with regards to Mr. Louis' other question about the number of MCs, I think this question has also been raised in your last parliamentary sitting, where a question was posed to MOM with regards to whether MOM will be studying ways to better support the injured workers. I think MOM has already given a reply that they are currently reviewing it and also performing public consultation with regards to this.